My name is Odette Miller.
Steve Biznov.
Catherine Lord.
I'm dealing with a condition called pemphigus vulgaris.
I am dealing with an unknown autoimmune disease.
And I am suffering from long COVID.
I have an autoimmune condition.
I have relapsing polychondritis.
And I have Castleman disease.
Granulomatosis with polyangiitis.
I have MS.
And for about the last 2 years, I've been suffering with long COVID.
My body and my health was deteriorating. And to have a 3-year-old and not know what's wrong with me, it was just traumatizing.
I seem to have a unique version of a rare disease, and there's always so many questions and so much unknown.
Because Castleman's is so rare, it's very hard to find a doctor that's versed in it.
It took years to get a diagnosis, and I suffered immeasurably during that time.
I had nasal symptoms, I had lung problems, I had strange rashes on my skin.
I felt nausea, I felt extreme fatigue. They were testing me for every known disease under the sun.
I started to notice changes in my cognitive abilities, the brain fog.
I had these blisters, lesions, blisters all over my body that would burst anytime I moved around.
You know, all of these different problems all happening at the same time. And I remember wondering if I was going to make it.
Autoimmunity is a particularly challenging field. First, many are rare diseases that are difficult to diagnose and treat. And secondly, the immune defects that cause disease are complex.
So we're very fortunate to have the generosity and support of the Coltons to form this Colton Center for Autoimmunity.
So the Colton Center serves to unite physicians, researchers, and entrepreneurs working across Penn to focus on the goal of improving our treatments and understanding of autoimmunity.
I feel like this condition really distorted my appearance. You know, I can put a wig on to cover up the bald spots, but as far as my mouth goes, with the bone loss and the gum receding, it's very hard.
My spatial awareness wasn't there, my verbal skills weren't there. Going to school and teaching kids was pretty much impossible. I couldn't get through in my own brain how to process a preschool art lesson plan, much less teach it to those preschoolers.
When it first started, my wife said I didn't remember her name. I also had a tremor, and I was so weak in my legs, I had to go in a wheelchair.
When you're sick, sometimes you do want to give up because it seems like every day.
Is everything stable, or is it getting worse again? You don't know.
I'm just trying to push through because of everything that I experienced in the past with my medical support team. There's hope.
I really think Penn was the best place for me to go just because it was a huge group of people and all these different resources working in conjunction. It was a whole team getting me to where I needed to be.
We've had to understand the immunology of COVID-19 and of these new mRNA vaccines at a pace that we've never done before. We've learned more about the human immune system in the past 2 years than we probably learned in the previous 20 years. In some ways, this is the perfect time for a Colton Center for Autoimmunity to be started because we can capitalize on that pace of science and that foundation that's been created.
You know, it's places like the Colton Center that are going to enable more people to live in a way that frees them from having to be in a hospital all the time.
I feel incredibly lucky to have here at Penn one of the leading experts in this extremely rare disease.
If you're battling an autoimmune disease, you have hope and you'll make it out all right.
I don't want anybody to have to go through what I did.
As they continue to do research and find solutions for patients with autoimmune diseases, it can continue to give me my quality of life and find solutions for us, help to put us into remission even.
This is the reality of what patients are dealing with. This is why we have to strive to do better as physicians and researchers to make better treatments for our patients.
The mission is clear. The things we have to do and solve are really understood across the spectrum, and we end up being really unified in why we're there and what we're trying to accomplish. And that's a really special feeling when you come into a meeting with the opportunity to make a really big difference in a disease like autoimmunity.